Welcome, everyone. Thank you for being here today. My name is Liz Flannery. I use she, her pronouns. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health, or AIDPH. Today, we are talking about veteran oral health in California. And again, thank you everyone for being here and joining us today on this very important discussion about the state of veteran oral health in your state. We can go to the next slide. So today I'm going to go over a few housekeeping pieces as the facilitator here today. And after that, I will hand it over to Annalise Cothran to go through our presentation, giving an overview of the national overview of veteran oral health, and then again, moving into veteran oral health specifically in California. After that presentation, we'll move into a discussion portion, which really is the most important aspect of this call. We're excited to be here with all of you today as stakeholders in California and oral health stakeholders. We really want to hear what's happening in your state, success stories, etc. So we're excited for that portion. And we'll have some conversation pieces peppered throughout the presentation as well. And then we'll talk about action items and next steps. You can go to the next slide. So again, just starting us off with some housekeeping pieces here today. This session is being recorded. We want this to be a discussion. If you have a question or a comment as we're doing the presentation pieces ahead of the discussion, please pop it in the chat. And then when we come into discussion, we can raise hands or just come off mute. The resources and recordings for this session will be posted to our website, and we invite you to introduce yourselves and welcome everyone else. So please type your email and your organization in the chat to say hello. And if you have questions, again, questions in general, questions about the presentation, but questions about Zoom or technical issues, please pop it in the chat, and I will help you out, or my colleague Rahel will help you out on that. We can go to the next slide. So the learning objectives that we're covering today, after this session, participants will be able to analyze state-specific veteran oral health data to identify key disparities and challenges using critical thinking skills to inform advocacy efforts. Participants will be able to evaluate existing policies and advocate for reforms to bridge gaps in veteran oral health care access, employing a strategic approach to policy change. Participants will collaborate with local stakeholders to develop data-driven oral health advocacy plans, fostering teamwork and coalition building. And participants will be able to formulate evidence-based strategies for utilizing the knowledge gained in this session to advance veteran oral health in your state, California, demonstrating the application of acquired knowledge in real-world scenarios. We do have CEU options after this program, and we will share more of that at the end of the session. Attendance of the entire session is required for those CEU pieces. We can go to the next slide. Our speakers don't have any conflicts of interest or any other disclosures to share today. And we have who we're speaking again. Myself, Annalise Cothran, is our executive director here at AIDPH, and we want to give a big thank you to Tuka for helping us coordinate this program and making it possible that we're all here today. So thank you, Tuka, and we can head on to our next slide. So without further ado, I will pass it off to Annalise Cothran. As she's getting started, we want to hear from all of you about veteran oral health in your priority areas. So we're going to launch a poll that will pop up for you, and we encourage you to respond to that as Annalise is getting started with our presentation.
Thanks so much, Liz. And thank you to everyone who's joining us here today. We're so thankful to be partnering with CDA Foundation and really bringing some awareness to the specific issues that folks in California, essentially issues that you can get engaged with in terms of advancing equitable oral health for veterans. You may or may not know that veterans, California veterans, are the highest number of any state in the US. So California actually has a really important role to play in being able to advance equitable oral health, both on the state and the federal level. And so we really appreciate folks wanting to highlight veteran oral health and really be engaged and activated in solutions, both in the state of California and nationally. So looking at our veteran oral health priority areas, I just want to make sure folks have a couple more minutes to participate in that poll if you haven't been able to make your selections yet. But in case you're new to working with AIDPH, AIDPH recently revamped our mission and vision statements, which is really exciting because it really reflects the work that we're doing, which is to empower communities to advance oral health through science, education, and advocacy. And really, our veteran oral health portfolio spans all three of those areas, where we invest in community engaged research to then push education and advocacy efforts to improve the oral health of veterans. And ultimately, all of that work is toward a justice-oriented oral health system where marginalized people are able to equitably access oral health care and overall comprehensive care more effectively. AIDPH has 4 core communities of focus, one of whom is veterans, which is why we're engaging in this virtual road tour, because veteran oral health is critical to our work and our mission. We also focus on rural LGBTQIA plus people and people with disabilities. And in particular, we focus on the intersection of these 4 core communities of focus. You'll see here that we'll talk a lot about in this presentation, rural veterans and veterans with disabilities, which again, really defines that intersectional work that AIDPH finds important and also tackles these issues in an intersectional manner. We want to thank CareQuest, Institute for Oral Health, for supporting this work. We've actually been partnered with CareQuest pursuing equitable oral health for veterans for quite some time. So in 2021 was when AIDPH began to focus on veteran oral health. And at that time when we were approached, the question was, what are you doing with veterans right now? And despite having lived experience with my husband being a veteran and myself still being a beneficiary of the military healthcare system, even right now, I understood, I guess, generally what veterans experience and the military culture, but I actually didn't know anything about veteran oral health specifically, which is really odd considering I'm the director of an oral health nonprofit. So in 2021, I really dove into the available resources and research at that time. And the answer was there really isn't anything. And because there were no data available, because there were very few insights available for us to base interventions or strategies or recommendations, we decided that we actually needed to conduct research. We really needed to start at baseline. And that's how our community engaged approach began, was partnering with veteran service organizations to understand the outcomes, to understand the experiences and understand the potential barriers or facilitators of around veteran oral health care. And that's when we started publishing that research and really exploring all of our research options. And thankfully, at this point, we are now invested in applying those research insights and developing resources for application, which is why we're on this virtual road tour here today as part of that application phase of what we found and now how people can really more effectively utilize that research in their daily work. Okay, so I'm going to share the results. If you haven't been able to vote yet, that's okay. But when I look at what this group is focused on in terms of priority areas, it looks like policy advocacy is rated right at the top, which is really fantastic because there'll be a lot of exciting resources that you can look for today to help advance that work in terms of policy advocacy. But we'll also touch on those other areas like access to care and integration with general health care. So hopefully we will be able to meet those top priority areas and even give you some resources in those other places of interest too. So let's start with veteran oral health at the national level. What does that look like? And I actually find that this is a really helpful slide for most people, or set of slides for most people, because this may be not common knowledge, and number one, and number two, it's actually really confusing even for folks like me and Liz, who are both beneficiaries of the military healthcare system. Just who is eligible for what and how can be a really confusing process. So to kind of start things off with setting the context for that, the VA and how veterans are able to get dental care and all care through the VA is set through a congressional process. So Congress, through the federal code, and specifically Title 38 in the federal code, defines who is eligible for all kinds of care, including dental care, and then at what level they are able to access that care or fund that care. And so by default, in order to change that eligibility, you have to actually change the federal code through passing legislation. That is the only way to do that. And you also have to ensure that if there is a change in eligibility or if there's an expansion of what is covered, there's also a budgetary process that has to occur at the same time for that care to be able to be funded through a benefit system. So when we're talking about policy process at the highest levels federally, we understand that it takes a lot to create that change. And right now, Title 38 of the federal code has very strict eligibility guidelines. In fact, they haven't been changed in over 70 years. So the eligibility criteria have stayed the same. And when you're looking at the 20 million veterans here in the US, almost half of them are eligible for care through the VA. You become eligible for care through the VA by having some sort of disability status rating. So throughout your military career, whenever you are separated, either retired or leaving or whatever that separation status looks like, you are evaluated at the VA. And if the VA provides you with a disability rating, you are eligible for some level of care. For those 9 million veterans who are eligible for care through the VA and can get some type of primary care through the VA, only 15% of that is eligible for dental care specifically. So looking at the tiny portion of dark blue and red, that is the number of veterans who are eligible for dental care in the VA. That red half of a person are the 1/3 of that 15% that actually utilize that benefit, which is a really, really small amount of veterans who are being seen in the VA. What that translates to is most of the care for veterans is happening outside of the VA system. And instead, it's happening in FQHCs and private dental offices, or it's just not happening at all, which is why we're here looking at opportunities to stimulate solutions at the state level. So we talked about at the beginning our priorities around holistic and integrated care. And what we found through our research, really focusing on care integration and the exacerbation of chronic disease conditions among veterans, is that veterans disproportionately have higher rates of heart disease and diabetes, among other chronic disease conditions, but those two in particular. So veterans compared to non-veterans have higher rates of those disease conditions. And even in data, this is part of an analysis that we did a couple of years ago. So even in data that indicates that veterans may have a higher frequency of dental visits in the past year compared to non-veterans, even if that is true, we're still seeing worse oral health outcomes for veterans with chronic diseases, including heart disease and diabetes. So looking at the darkest blue and red bars, veterans with heart disease and diabetes are far more likely to have lost all of their natural teeth compared with non-veterans who have those chronic disease conditions. Even after controlling for things like virality, which we'll talk about later, education, etc., veterans with diabetes were 40% more likely to have lost all of their natural teeth compared to veterans without diabetes. And veterans with heart disease were 30% more likely to be edentulous than veterans without heart disease. Now, we'll tell you why we're focused on these in particular, and that's because those two chronic disease conditions exacerbate poor oral health and vice versa. And we know that care in an integrated environment is not only important for better health outcomes, but there's a demonstrated cost savings that comes from treating giving better oral health treatment for those chronic disease conditions, because it will save costs on the medical side. So for diabetes, every dollar spent on better access to oral health care results in a dollar saved. So that essentially pays for itself. And with heart disease, it's double the cost savings. When we're talking about VA dollars, it's cost savings in the billions just to give veterans better access to oral health care, particularly within those chronic disease conditions. And we have all of this laid out here in our research that really shows that veterans are struggling to access dental care, that veterans with chronic disease conditions are the highest risk, highest cost veterans, and should be really a priority focus, both federally and at the state level, which we'll get to in a second. And that there are a lot of different solutions and strategic recommendations built into all of these reports for states to take advantage of. We also have two different opportunities for state-based insights, and we're going to go over those today. One is a veteran data dental repository, where you can, or dental data repository rather, where you can look at state-specific insights, including maps of where different clinics are in your state, including FQHCs and VA dental clinics. And then what we're going to deep dive in a little bit today are our state oral health profiles for veterans in California. And I believe those are being put into the chat right now. Thanks, Liz. So we invite you to pull that up for your state, and we'll just double click a little bit on what these profiles look like and how they can be used. So looking at California, the first thing that we've done is kind of give some context for how you can be considering the data around your state profile. And we have really highlighted those areas that we talked about in our research result in the highest risk and highest cost to the system, and also results in the worst oral health outcomes, which is those conditions of diabetes and heart disease. We've also looked at rurality because we know that veterans are disproportionately located in rural areas. And we know that rural people in general, to include veterans, struggle with access to dental care and all types of healthcare. So we've tried to focus in on those areas that are experiencing the highest disparity, and also have the opportunity to be kind of in that advocacy area for increasing access and increasing quality of care. So each state will have a kind of percentage of veterans by county, so a visual disbursement of where veterans are located in your state, with the darkest colors being the highest concentration of veterans. So for the state of California, there are about 1.6 million veterans, which again is the highest of all of the states, creating an opportunity for California to really lead in the veteran oral health space, given how many veterans are located in your state. The three counties that have the highest veteran population are Amador, Modoc, and Tuolumne. The next piece that we highlighted in our state profiles are really comparing how California performs in those chronic disease categories. Again, recognizing these are high risk, high cost areas with really poor outcomes for veterans compared to non-veterans. So how does California compare to other states? And in particular, we ranked all of the 50 states in these health conditions, with the worst being rated number 1. So if you're number 1 in heart disease or diabetes, that would not be ideal. And it looks like California is frankly really leading the pack in terms of oral health outcomes. So that says to me that California is doing something right. They are helping veterans here, and the spaces and policies and really care delivery avenues that have been cultivated here in California have resulted in the lowest rates of indentulism and heart disease, and really low rates of uninsured people too. So I think that that's really important to highlight here from the very beginning. A lot of the other states that we've presented that don't have as high a success as California. So I think this is something to really be celebrated. I think California should really, again, celebrate this report card. We created this report card because report cards are something we've been getting since we were really little. We all tend to really understand what a report card is and what it means. And hopefully this is something you can take to a decision maker, perhaps a policy maker, or somebody in that space who is making decisions about care delivery or interventions or opportunities for improving the oral health of veterans. And this report card makes it really easy to understand where your state is at and baselines for improvement too. So while California has an overall grade of an A, which is so exciting, and many congratulations, there are still opportunities for improvement. There are also opportunities for you to say, this is where we were at baseline, and we definitely don't want to go down. We really want to stay here. And also, let's take a look at why California is performing so much better than the other states. What are the drivers here that are leading to our success? And let's make sure we keep those in place and really lean into them in other spaces. So how can you use the state profile? Well, one thing is we want to hear from all of you. What comes to mind for you in terms of use cases for your state profile compared to, what you may have done before that's really successful, or other resources that you could replicate the application with these state profiles. But what we've heard from our partners are that this is a good tool for advocacy. And I heard from all of you in the very beginning that policy is really important. And this would really fit into that priority space of advocating for policy changes, social interventions, and improved access in those areas that really need more attention. This state profile is a really easy way of educating somebody about veteran oral health in your state. We've tried to design these in a manner that's easy to understand, using common language and visuals that help stimulate understanding and knowledge gain really quickly and easily. And hopefully that can also help you communicate to decision makers. Ultimately, you know who the decision makers are in your state, and you understand what those decision makers want to hear, the resources that they may need. And this can be a tool to help stimulate those conversations about informing the work that you're doing, or identifying a program or a policy or some sort of intervention that can really create strategic direction in your state. Lastly, we want to point out that sometimes it can be really hard to find data. And oftentimes when you're putting together a report or seeking funding for a program, you really have to make that a data-informed decision or a data-informed strategy. And we hope that the data that we've presented today can help stimulate some of those opportunities. We know our partners at CareQuest currently have a request for proposals around veteran oral health. And so it may be that you look at your state report card or your state profile and highlight the areas of need and opportunity that you can use to underscore some of those potential calls for funding or action. We also just wanted to present what it could look like to do a deep dive in your state. Our partners in Iowa actually invested in a very comprehensive kind of state of the state and for veteran oral health in Iowa. And something like this takes a lot of time and energy, but it really results in a comprehensive set of strategic recommendations based on all types of stakeholders, like policy stakeholders, nonprofits, associations, researchers, academicians, government workers. And really, this report helped dive into what each target audience could do to advance veteran oral health in their state. And in fact, lots of policy recommendations were made, like looking at this trust fund opportunity in Iowa and improving that, expanding access to Medicaid, what that could look like. And we point this out because not only is this a great process for a state to follow or replicate, but there are lots of recommendations in this report that you may want to look at and see if there's something that fits for the state of California. It's something that you could borrow from this strategic set of recommendations and see if there's an opportunity for application in your state. And so with that, I will open the floor up for questions, or we can hop into discussion. It's really up to you. So I'll stop sharing my screen and we can just chat a little bit.
Thanks, Annalise. I'm going to also post some questions in the chat. But as Annalise said, we can veer to other pieces or topics as well. And I'll just start us off, and if this sparks anything for folks, we can go in this direction. One of the things that is most important with this project that we're doing, going state to state, is states have really been asking what other states are doing, what other states are seeing as best practices, successful. And we're really working to gather the discussion, the information that's discovered in the discussion section of these seminars, to put together a compendium of best practices and successes, or what barriers need to overcome to kind of really give that direction of steps people can take, and where we need to go with the research and other pieces that need to be filled. So I would love to kick us off if folks have success stories of working in veteran oral health policy, programming advocacy that's happening in California right now or has been successful, or where you see yourself or your organization going in those pieces. And I would also say, please hop in with questions or other pieces that were sparked by Annalise's presentation. As we said, that by no means has to be the exact direction we go in.
I can jump in. Hi, Tuka from the California Dental Association. And I know that we've been trying to share some of the best practices to increase more providers that accept veterans in their practice, and make sure that they're sharing that opportunity and saying that this is a place that, you know, you're welcome. I don't know if there's other states that kind of have a best practice for you to share. I know you said California is doing pretty well. And we know that when you look at it at the county level, you know, there are some disparities at the county level, but really interesting. I know we have another part 2 of this webinar where we will be highlighting some individuals, and I see Dr. Nagy's on the call as well. But for, you know, just to, as any best practices that maybe California is not doing, have there been other states that have had like really strong provider engagement, or any kind of messaging that can be improved? That would be great to know about.
Yeah, thanks, Tuka. You know, one thing about the Iowa report that helped us examine from a policy perspective is that Iowa has a really engaged sort of set of stakeholders who have been advocating for policies like the Veteran Trust Fund. I don't know of any states that are putting together specific best practices for their location. We do have a best practice document that we put together for FQHCs and really other kind of clinical stakeholders around veteran oral health that we put together with the National Network for Oral Health Access, or NOAA. So I point folks to that document if you're interested. But we've been kind of propping up this Iowa Veteran Trust Fund as a potential best practice and a policy solution for states to consider, because it really leaves a lot of flexibility for those dollars to be used for out-of-pocket costs around veteran oral health care and other healthcare pieces. So the way that Iowa implements that fund is that state funds are appropriated essentially through their legislative process, and then those funds are granted out to individual veterans so that they can apply for those funds to cover out-of-pocket costs. And that's a really innovative way. I know it sounds commonplace, but actually getting funds to go to an individual to cover healthcare is not always common from a legislative perspective. And in interviewing stakeholders in Iowa, all of them really reinforced how important that fund was in closing the gaps of healthcare, because it still allowed for a lot of flexibility for veterans to pursue the type of healthcare delivery that works for them in their area. But to be able to have those costs covered through some financial support from the state. So I like to prop that up as a best policy practice. And then we do have a set of clinical guidelines that really does focus on integrated healthcare for clinicians who may be interested in looking through care delivery options for veterans.
Great, thank you.
Okay, and as we go through some of our next pieces, I also, again, invite folks to circle back. So our next question that we like to discuss is what you thought of your state profile. Were you surprised? Is it what you expected? And then really also what data gaps you think might need to be explored in California, if any. Again, this is really kind of that important piece of completing that loop of the community engagement and seeing what pieces might be missing might be helpful to inform that next step in the research process. Giving us our 7+ minutes. That was a piece our team was on the line with an educator earlier this year, and they referenced a 7-second pause to give folks enough time to process and respond. So I will take that nothing's popping to mind for folks right now. And we'll also just share if something comes up, you're welcome to put it in the chat, or always circle back with us and contact us offline as well if there's something that you want us to capture that occurs to you after this session. And so I think finally what we wanted to talk about are similar to what we covered at the beginning. What resources are most important to you or useful to you in your role, your position in advancing veteran oral health in California? And I invite folks to share that out. You can put it in the chat. We're also going to pop up a poll here so folks can answer with some more specific options and kind of look at pieces that are possible. But if there are things outside of that poll, we would love to hear those too.
Are you sending the poll now, or?
I was just gonna, Rahel, are you able to pop that poll? Is it popping up?
Oh,
Okay,
there it is.
thank you.
Sorry, it was taking a while to load.
No, that's fine. I had minimized it before, so I just wasn't sure if it was me that it was not showing up for or not.
Yeah, one of the pieces CDA also is trying to strengthen is how individuals themselves who are on veteran healthcare but may not qualify for oral healthcare through the veteran program, because there are like different levels of qualification, how we can better communicate that. It is a little bit confusing on the different veteran websites and like for benefits. So that is more for patients than like dental providers. But, for dental providers to also kind of be better aware of, who is eligible, what kind of coverage is it, how does it work? So it doesn't seem like so like out of there, like, oh no, I don't understand that, to see it's actually very similar in so many ways. So that's something that we've received as feedback. And then another piece is kind of those one-day care events and kind of if there's any evidence on like if those are still effective or if there's a different model. I know we're going to be exploring a lot of these things in the next webinar, and this is really to prep us for that, to see if any questions come up today, but that's what CDA has received at least. Yeah.
That's great. Thank you for sharing that, Tuka. And Annalise, I don't know if anything's popping up for you, but for me, that really resonates. I feel like is similar to what we're hearing from other states, some of those education pieces around getting folks to understand benefits and kind of how do we do that? Who and how do we partner with in the community to get that education, both for providers and then to communicate it out. I don't know if anything else popped up for you, Annalise.
No, the only thing it kind of, when you were talking about the efficacy of those kind of missions of mercy or one day or charitable programs, I don't know of any evidence that really provides a solution one way or another. I think by and large, what we know is that anything that makes the systems change, that advocates for a systems change solution versus kind of a band-aid, like some of those one-day events can be, is going to be more effective in the long term, especially associated with those data surrounding care integration and chronic disease management. So I think the goal is to really invest in the prevention side of things and not wait until there is a restorative need or something like that associated with some of those kind of one-day programs that are fixing immediate, often urgent, unmet needs. And that often means that that care is more costly, can also be more painful or invasive. And all of our research really points to the cost savings and not having to go through the pain of unmet dental need if you can invest early in the disease process, and in particular in an integrated way.
Yeah, Tuka, if you don't mind a follow-up question, I would love to know if is that a piece that would be helpful? Are you hearing that in conversations from decision makers and stakeholders that maybe they're leaning more towards those type of programs versus a more long-term fix, or would data be helpful? What are you seeing folks think
Yeah.
around those programs?
I mean, we've seen different things. A lot of it is anecdotal. I think the big thing is just we've been asked like, what is there? So I think like a list of the different options for both the long term and the short term. We do have members that actually lead a lot of like one day or one patient, like trying to break some stigmas or kind of one patient, and then that can become a patient panel. So I don't have a specific answer. Kind of looking at the poll as well, I think a lot of like, what are the rules? What are the parameters? I think dentistry can be really like in the fog a lot of the time when it comes to how like different dental benefits work. And because veteran oral health is very different than veteran health for other medical kind of coverage, and this is the same with like other kinds of dental benefits where the packages are very different than some of the private market, or even if veterans are in the private market, like what that means. So just to kind of demystify veteran oral health in general, and make it really clear, because unless, I mean, this is something we can also kind of maybe find out more from dentists, but from what we've heard feedback wise is it's not really clear how veteran oral health is in a lot of ways similar to other kinds of dental benefits. So to demystify and just make it really clear, because individuals that do qualify for oral health benefits through the VA, it's different. It's like there's very specific things that need to be met to qualify. And California does have a lot of individuals that still qualify, but just explaining that difference in a clear way, I think can be really helpful.
Thank you. Thank you for providing that insight. Okay, well, if folks, Annalisa, I don't know if you want to share the results of this poll looking at resources, I'll pass it back to you for that piece and talking through our next steps as well.
Yeah, absolutely. Thanks so much, Liz. So no surprise here. It looks like the types of resources that folks felt could be helpful moving forward mirrors the priorities we saw in the first part of the session, which is creating policy briefs that help, to use Tuka's words, demystify options maybe around veteran oral health. And we really do appreciate that feedback. Reinforcing what Liz mentioned at the beginning, which is we are using these sessions to highlight success stories and also highlight needs and direct kind of broadly what folks can do in the veteran oral health space, and wanting to democratize leadership in this area, which is why we're really excited about that RFP that CareQuest Institute has put out, because we believe that states and state-based organizations have the opportunity to really go in and invest in advancing solutions for veteran oral health. And seeing that there's a funding opportunity matched with that is really exciting. So we appreciate you giving us that feedback, and ultimately contributing to the broader knowledge base that we're facilitating nationally around this topic. So next steps, as we mentioned at the beginning, CEUs are available for today's session. The survey link should show up in your browser immediately after the session ends. So it's really best and easiest for you to fill out that, that CEU request immediately. There's also some evaluation questions that we would love to hear from all of you. The recording is available for today's session, and you can find all of the resources at AIDPH's website. In case you missed it, we are having our colloquium, AIDPH's annual colloquium, which is our conference, in like a week and a half in Chicago. And part of what that colloquium focuses on is advancing person-centered outcomes. So we will be focused on some of our veteran oral health work, and we'd love to see you there. I know Tuka will be there presenting too. And we also want to highlight our newest publication that was released in February of this year, may have been January of this year, on veteran oral health and productivity and well-being. So we actually looked at the impact of pain and loss of work days for veterans who are experiencing chronic disease conditions like heart disease and diabetes, and found that veterans do have more missed work days, and ultimately that leads to less productivity and potentially more costs for employers. So we would love for you to give that a look and look at those insights, and happy to chat about that with you if you'd like to talk with us about that further. As Tuka pointed out, this is part one of a part two stop at California. So our next webinar will be April 1st, and you can register for that webinar on our website too. And that's all that we have for you today. We want to thank you so much for joining us to talk about veteran oral health in California. We're always open for additional questions, so if something comes to mind, feel free to reach out. Otherwise, we'll see you next time on April 1st. Thanks so much.
Thank you so much. And then I know this is being recorded and shared. So will there be some opportunities to not just share, CDA wants to, of course, link to this webinar, but for individuals that couldn't join today, will there be a individual or a space for some of this feedback that they can't maybe join live, but to have a place to submit either information or thoughts? Because we know there is a CDA audience that wants this information but couldn't join today.
Sure. We would encourage folks to reach out to us at programs@aidph.org.
Okay, perfect.
You can also reach out to me personally at Catherine@aidph.org, and I would be happy to connect you to the right person.
Great. Thank you so much. We'll see you on April 1st.
Great. Thank you. Take care.
Bye.